that is medial epicondylitis. Bursitis. Bursitis, normally synovial membrane is become stretchy, then they will have fluid inside. Inside fluid, it's gonna cause them to have pain and they feel uncomfortable. So what do? You drain the fluid. If it's clear, you leave it alone. That's it. If it's cloudy, you send it in the lab. Either it's clear fluid or cloudy fluid, okay? You still give them steroids after bursitis. How do you stop the steroids? You give it, then you taper it down, then you stop it. You always taper it down. You don't do cold turkey with the steroids. Which is the most common cause for ankle sprain? Is it going inside or is it going outside? Inversion or eversion? Inversion, okay? Grades of the ligament tear, which is sprain. What happens with the sprain is ligament is tearing apart, okay? Take just, think about the paper, okay? Take that paper, tear it in the middle, just a little bit. There is grade 1 tear. Tear it halfway, partially torn, 50%, grade 2. Tear that paper all the way in 2 pieces. That is grade 3 tear. Grade 2 and 3 requires something, okay? Refer them because they cannot walk. Walking makes it hurt. Grade 3 is completely torn. So like they're going to have pain and unable to bear weight and stuff like that. So X-ray and refer them. Meniscus tear, there is like a oval shaped cushion between knees, knee joint. That cushion has tear. Normally this person is playing sport activity and all of a sudden hear this pop. Now patient is limping, locking of the knee, excruciating pain. Those are the classic signs and symptoms for meniscus tear. Remember, 4 M's for meniscus tear. McMurray sign positive, double M, MM, McMurray sign. So this M sign is very important because it comes in a lot of different conditions. Appendicitis, MacBook Pro, remember that. Murphy sign, remember gallbladder. McMurray sign, double M, remember meniscus tear. That's why you gotta remember 4 M's for meniscus tear. Meniscus tear, McMurray sign, and gold standard is MRI. Avascular necrosis of the head, femoral head, is dead. Person definitely gonna have pain, limping, and they have Trendelenburg test positive. That is Leg-Calve Perthes disease. So main sign and symptoms is pain, little babies, which is L. L means Leg-Calve Perthes disease, and little babies, that is L as well. So LL, remember this, because the other one can get complicated too. So LL, little babies, they will have Leg-Calve Perthes disease. This one would have pain and positive Trendelenburg test positive. So that's why they would have, it's skiffy. They both have same sign and symptoms. But this condition doesn't happen to little babies. Okay, it happens to like 17, 18, 19, 20 years old adolescent and morbidly obese male person. So that is skiffy. Little babies, Leg-Calve Perthes disease. 3 to 10 years of age. Above 17, that is skiffy. 16, 17-year-old playing sport activity, okay? They have this pain at the, this is your clue, anterior tibial tuberosity of the knee. See this picture? Kneecap, then connected the tendon. Tendon is pulling, okay, on that growth plate. That's why wherever they have circle right here, they're gonna have pain, redness, swelling up, okay. That is Osgood-Schlatter disease. Choice of treatment is rice. What happens with the Down syndrome? What kind of joint they have problems with? Atlantoaxial instability, AAI instability. They are also increased risk for hyperthyroidism. Newborn, they have positive Barlow's test and Ortolani test. What do you do? Refer them because they probably have femoral hair dislocation. Important ortho maneuver. What do you do if you are suspecting ACL tear? What maneuver do you do in the office? You can do Luckman test. You can do anterior drawer test. Which one is most accurate and reliable test? Luckman. ACL, L means Luckman. ACL, L means Luckman test. If you are worried about shoulder dislocation, what test do you do? Apprehension test to assess glenohumeral instability. If you worry about dequeverant tendinopathy, what test do you do? Flinkenstein test. Choice of treatment, NSAIDs. MCL, okay. MCL and LCL, both very important, okay? You only need to remember MCL. I'm gonna make this easy for you. MCL, that means medial collateral ligament. If you worry about tear, what test do you do? What maneuvers do you do? You ask the patient, stick your knees together, kind of like chewing gum. Gum. The test you are doing is valgum. It's actually valgus, but I'm gonna say valgum, okay? Because they are sticking their knees together, kind of like gluing together, valgum. M, that is for MCL, okay? That's it. Valgum, that's for MCL. And varus, it's for lateral collateral ligament. If person is having sciatica and lumbar radiculopathy, that's what it's called. Pain is radiating down towards their lower extremity. What test do you do? Straight leg rest test. Advise patient to lift it up and they're gonna have pain. That means positive for sciatica. Spinal stenosis, sitting down, they feel good. Leaning forward, they feel good. But standing up and walk, they are having pain. Person who is doing exercise every day, lifting, heavy weight lifting, and all of a sudden they're hearing this pop, okay? And you can easily able to hook your finger on their muscles. That's called hook test positive. That's for distal bicep tendon rupture. What do you do? If they have this Popeye eye on their right upper arm, okay, they're having bulge, it hurts, you can do hook test, you can do all kind of stuff. So that is distal bicep tendon rupture, and you refer this person to specialist. Then we have depression. Choice of treatment, SSRI. There are a couple of, there are only 5 SSRI, which is Lexapro and Zoloft. You're gonna give it for geriatric patient. Then there is Paxil. Paxil can cause them, male person, if they take Paxil, then it can cause them to have erectile dysfunction. So we try to avoid it for male person. And if they are taking Paxil and it causes them to have erectile dysfunction, then we can give them Wellbutrin to reverse the side effects or sign and symptoms. Geriatric patient, SSRI, Lexapro or Zoloft. The other medication we can do for, not for geriatric patient, but for everybody else, it's Paxil. Male person, if we do Paxil, it can cause them to have ED. And to reverse the sign and symptoms, we give them Wellbutrin. Herbal medication for depression, we give it St. John's wort. Okay, remember this. John has depression. John has depression. That is St. John's wort. That is for depression. Herbal medication. If somebody is taking herbal medication and they are taking Paxil, and you don't know that they are taking herbal medication because it's over the counter. They are not telling you. They are taking it for a couple of days, couple of weeks actually. They coming back to you with dilated pupils, hyperreflexia, high fever, rapid heart rate. Everything is just going fast. What do you suspect? Serotonin syndrome. Bipolar disorder, choice of treatment, lithium salt, okay, which can also cause them to have GI upset. Main choice of treatment for schizophrenia, typical antipsychotic. So here you have to remember, anytime you initiate any psych medicine, what do you have to get? Obtain EKG first, making sure that they don't have prolonged QT interval. And if they do, you don't initiate those medication, particularly atypical and typical antipsychotic. Because if they do have prolonged QT interval, that can cause them to have torsades points. Basically, they can have prolonged QT, PVC comes in the picture, they can have VTAC and VFib and then die. Herbal medication for anxiety, kava, valerian roots. Medical management for anxiety, SSRI. If somebody is having like acute or panic attacks, what do we do? Mild panic attacks, we don't do anything. Moderate panic attacks, we don't do anything. For severe panic attacks, like they are panicking, okay, then we can do short-acting benzos, which is, like it's gonna work instantly, Ativan or Xanax. How does the patient presents when they have PTSD? What are those main signs and symptoms? There are two signs and symptoms. They have this starter, like they're waking up at night. They have nightmares and they have flashbacks. Those are the main one for PTSD. Remember those two signs and symptoms because it's very important. Startling and they are having flashes. When somebody has insomnia, what kind of rhythm is disturbed? Circadian rhythm is disturbed. Anorexia nervosa and bulimia nervosa, main thing you want to know is choice of treatment for both of them is SSRI. How do you know that SSRI is working for anorexia nervosa patient? Return of menses. That means the treatment is working. Both of those patients, you don't give Wellbutrin because it causes them to have seizure activity. And why is that? Wellbutrin decreases seizure threshold. So when somebody's seizure threshold is decreased, it's gonna make them high risk for seizure activity. So it's pulling it down, okay? Seizure threshold, when it goes down, instantly they're gonna have seizure. So that's why Wellbutrin is not good choice of option for anorexia and bulimia patient. Cage mnemonics, very important. For person who has been smoking and they wanted to quit, what medication we can give them? Wellbutrin. It helps with a lot of different stuff. It decreases craving to smoke. Couple of medications. First two are very important, like when we initiate atypical antipsychotic, what do we have to watch for? We obtain EKG first and then we initiate, okay? After they take those medicine, what do we watch for? Diabetes, because it increases their blood sugar level, weight gain. Those are the two main things. For atypical antipsychotic, those are Seroquel, Zyprexa, or Risperidol, okay? Particularly for Risperidol, it can cause person to have what? Galactoria. They may ask you this question like, person who is taking atypical antipsychotic or they are taking some psych medicine, okay, and they are experiencing galactoria. Which medication can cause them to have galactoria? Risperidone can cause them to have galactoria. Most of the stuff, from pharmacology review, we know this, but a couple of things that I wanted to go over, which is which bacteria can cause person to have impetigo? Well, whatever is on the skin, it's gonna go inside, right? So on top of the skin, we have Staphylococcus aureus and Streptococcus pyogenes. It's gonna go inside and cause them to have bacterial infection. Penicillin group of drug. If they have, if they're allergic to penicillin, can we able to give cephalosporin if they're allergic to penicillin? The answer is depends on what kind of reaction are they having with penicillin allergy. Okay, if they're having life-threatening emergencies, life-threatening issues with penicillin, then we don't give them cephalosporin. If they are having just simple hives with penicillin, then we give them cephalosporin. Those are Ceph group of drug, which is cephalosporin, which is Ceflex, Cefdinar, Cefepime, CEPH or CEF. Those are those drugs. Rosafin, stuff like that. Ceflex, those are cephalosporin. So if they are having life-threatening emergency with penicillin, then we don't give them cephalosporin. Otherwise, it's okay to give. Fluoroquinolone, don't give it in pregnancy, don't give it in pediatric. If pediatric patient takes fluoroquinolone and they present to you with ankle pain, very important question. What do you suspect if they present to you with ankle pain? Achilles tendinopathy. That's why, don't give it to pediatric patient. Person who is allergic to macrolides and they're having nausea, vomiting, abdominal pain. So you have to know which macrolides can cause those side effects. Not azithromycin, it doesn't do that. Erythromycin does. Okay, so if in the exam, if they tell you person is allergic to macrolides, you have to be open and think which macrolides does it. Not like every macrolides cause those side effects. Early generation erythromycin has and had caused a lot of side effects, and that's why they had to come up with later generation, which is azithromycin. So if they have side effects with erythromycin, then simply you're gonna switch it to azithromycin because it doesn't have a lot of side effects. Person who is using